Welcome to the Paubox News Roundup for the latest HIPAA, security, and healthcare marketing news. I hope everyone had a fun 4th of July and is enjoying their summer so far. This week we have news about the HCA Healthcare breach, which may be one of the largest ever in the healthcare sector, the Murfreesboro Medical Clinic ransomware attack, and a new strategy to combat ransomware attacks. We'll also touch on the HSCC Cybersecurity Work Group's new guidance that aims to help hospitals plan continuity in care even in the absence of critical technology. HCA Healthcare, one of the largest healthcare providers in the US, has suffered a significant data breach, potentially affecting 11 million patients across 20 states. The breach, discovered on July 5th, involved the unauthorized release of patient names, contact information, service dates, locations, and appointment dates on an online forum. However, clinical information, payment information, and sensitive data such as passwords, licenses, and social security numbers were not reportedly included. Despite HCA's claim that no clinical information was breached, this has been challenged by databreaches.net, who reported that the hacking group provided them with a sample set of data about patients' low-risk lung cancer assessment. However, an HCA spokesperson claimed that the sample dataset was marketing campaign data and not an individual patient's PHI. HCA said in a press release, "While our investigation is ongoing, the company has not identified evidence of any malicious activity on HCA Healthcare networks or systems related to this incident." HCA has disabled user access to the compromised storage location, and they plan to contact impacted patients and will also offer credit monitoring and identity protection services where appropriate. Up next, Murfreesboro Medical Clinic, a Tennessee-based healthcare provider, suffered a ransomware attack in late April, potentially affecting approximately 559,000 patients and employees. The breach claimed by the ransomware organization Bianlian may have resulted in the theft of sensitive data, including names, social security numbers, medical and diagnostic information, procedure notes, and insurance information. The attack disrupted MMC's services, particularly their laboratory and radiology services, and led to the implementation of updated security measures to prevent future attacks. MMC's CEO, Joey P.A., stated they would not be paying a ransom, a growing strategy among healthcare organizations to make ransomware attacks less effective. Which brings us to our next segment. With a 67% increase in ransomware attacks between Q1 and Q2, healthcare organizations are being forced to rethink their cybersecurity strategies. One emerging trend is the refusal to pay ransoms. It not only funds malicious organizations, but doesn't even guarantee the prevention of data being sold. While some organizations may consider paying ransoms in extreme cases, experts generally advise against it, suggesting instead that resources be invested in enhancing defenses. The impact of this no-pay strategy on the frequency and severity of future attacks remains to be seen. John Ridgey, Senior Advisor for Cybersecurity and Risk at the American Hospital Association, says the situation needs new infrastructure and strategies to combat ransomware, as paying ransoms incentivizes future attacks. He goes on to say, quote, "You're funding a criminal organization which may have actual nation-state sponsorship and backing." Patterson Cake, a consultant with cybersecurity firm Avertium, suggests that healthcare companies put money into updating their defenses instead. But of course, this is a difficult ask after the attack has occurred. It's a little like closing the barn doors after the horse has bolted. So it's best to be proactive in cybersecurity. Speaking of which, the Healthcare and Public Health Sector Coordinating Council, Cybersecurity Work Group, has released a new incident response template aimed at improving breach responses in the healthcare sector. The template is designed to help hospitals maintain continuity of care during a breach, even when critical technology is unavailable. It provides a framework for incident identification, external communication, and containment strategies. The template is particularly useful in situations where business-critical information systems or endpoints are unavailable, or when an attack could potentially spread to these systems. The HSCC emphasizes that the template should be used in conjunction with other strategies to repair infrastructure and prevent future breaches. Now that we've covered the latest news, let's shift gears and delve into some informational topics. Ever heard of cyberpsychology? Well, cyberpsychology is a field that investigates the impact of technology on human behavior and mental processes. This is done by exploring online behavior, internet addiction, online identity, cyberbullying, virtual reality experiences, and human computer interactions. I'll leave a link in the description below if you'd like to learn more. Text messaging has become integral to communication in various sectors, including healthcare. And yes, healthcare-related text messages do contain PHI. Paubox wrote a guide to HIPAA-compliant text messages to help you understand how to keep your texting secure. Also, link in the description. Did you know that in certain situations, a caregiver may have access to a disabled person's health information without explicit consent under HIPAA? We go over those exceptions in a new article, also linked in the description. Lastly, I asked ChatGPT to write an original HIPAA-related joke. Ready? Why did the server go to the gym? Because it wanted to strengthen its encryption muscles to better protect HIPAA data. I don't think AI will be putting comedians out of work anytime soon, but that's it for now. See you next time. Cheers.